Good afternoon, everyone. I was in the room 10 minutes before, but nobody was in. So I step out, and I'm surprised that the room is almost full. My gratitude to all of you for your presence in this room and your participation in today's meeting. The fourth annual symposium is organized under the overarching theme of mitigating climate change through One Health. I'm going to focus on the holistic approach of conservation of human, animal, and plant species through One Health, as well as the promotion of carbon markets as one of nature-based solutions to address the financial gap linked to the cost of reducing greenhouse gas emissions. In the past, the holistic approach to conservation through One Health was the result of tripartite cooperation between three subsidiary organs of the United Nations, each having within its mandate responsibility for human health. That was WHO, Animal Health, World Organization for Animal Health, and Food Health, Food and Agriculture Organization of the United Nations, FAO. Indeed, it is after having learned lessons on the consequences of a COVID-19 disease that the World Health Assembly, during its 74th session on May 31, 2021, requested to build on and strengthen existing cooperation between WHO, FAO, OIE, and UNEP to develop options for consideration by the respective governing bodies, including a joint work plan on One Health to improve the prevention, surveillance, detection, and control of zoonotic diseases outbreaks. The following year, as of March 17, 2022, the tripartite officially became the quadripartite collaboration with the United Nations Environment Program, UNEP, as the new partner to One Health. To mitigate climate change through One Health, the Democratic Republic of Congo has adopted the One Health approach. At the national level, we recognize the interdependence that exists between the health of the environment, that of humans, as well as that of animals. This is why our government established the One Health platform, which brings together different ministries, organizations, and stakeholders to coordinate efforts and address health threats. In this regard, the experience of the Ministry of Health and that of the Environment, which have implemented various programs and projects linked to One Health approach, can be a source of inspiration. In particular, the disease surveillance and control programs, as well as that of the conservation and of sustainable forest management. With more than 62% of Congo Basin forests, the forests of the Democratic Republic of Congo have a strategic position in reduction greenhouse gas emissions, which therefore contribute to climate change mitigation. At the national level, we have made important contribution to Sustainable Development Goal 15, SDG 15, Life and Land, including efforts to protect and restore forests, combat illicit trafficking of wildlife, and promote sustainable agricultural practices. According to a 2022 report issued by the UNDP, national parks and protected areas cover 10% of national territory. Regarding conservation financing, the Congolese government has approached the United Nations Development Program to be able to participate in financial markets to implement effective nature-based solutions capable of contributing to reducing greenhouse gas emissions and therefore contributing to climate change mitigation. Number one, in November 2022, with technical assistance from UNDP, the government of DRC established a roadmap to access carbon market and to strengthen DR Congo capacity to mobilize climate finance and implement its nationally dominated contributions. Number two, UN RED program in partnership with UNDP is creating carbon markets that work for Africa, including for my country, the Democratic Republic of Congo. Furthermore, as far as protecting biodiversity is concerned, it has to be pointed out that our goodwill to fight illegal wildlife trafficking is literally undermined by occupation of Congolese territory by M23, backed by Rwanda Defense Forces in Mikeno sector, where the M23 has destroyed forest areas and is threatening mountain gorillas. Ladies and gentlemen, the annual symposium on wildlife conservation in Africa is also an awareness campaign on the conservation of animals and plants, of which health status can have adverse impact on human health. It is therefore with these opening remarks that I end my speech here. I thank you, and this meeting is open.
Thank you.